At Meds Plus Consulting Pharmacy and Wellness Center, you're not just a number. We offer individualized care for each of our patients, plus prescription delivery and medication management.
Meds Plus is there for any and everyone who wants a special touch with their pharmacy needs.
Call or visit today for a free consultation.
Bringing the pharmacist back to the community, Meds Plus Consulting Pharmacy and Wellness Center.
Visit Meds Plus Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.
Good afternoon, everybody. Good afternoon. My name is Dr. Pauline with Meds Plus Consulting, and we are here at 1 o'clock on Monday for another episode of Meds Plus Medical Minute. So excited for you guys to join us. And today I'm really excited. We are continuing in our talk of Mental Health Awareness Month. And throughout this month, we've had some great speakers each Monday just talking about their journey through mental health. Last week, we had a therapist online. And I'm very excited today that we have another mental health professional. And I will invite her to the stage. I want y'all to welcome Miss Crystal Mullen-Johnson.
Hi. Hello. Happy Monday.
Happy Monday. How are you today?
I'm great. I'm wonderful. I exercised this morning, so I'm showing up my best self, you know?
All right. Listen, I understand that. And we know that wellness is holistic. So it's not just about physical health. It's not just about financial. It's mental, emotional, all the things, right?
Certainly. Absolutely. And I'm one that truly believes in like that holistic approach to health, you know, and exercising is one, eating well and taking care of my mental. And as I encourage clients to do that, that's a responsibility that I have as well.
Absolutely. Absolutely. Practice what you preach.
Yeah, or walk it like you talk it.
There you go. There you go. I like that one. So yeah, I want y'all to meet Crystal Mullen-Johnson. She is the founder of Strive Counseling Services and Nurture of Alabama. So tell us about those organizations, Crystal.
Absolutely. So Strive Counseling Services is a mental health for-profit organization, and we provide counseling services to children, adults, and couples. We have therapists that specialize in providing evidence-based treatment. And when I say that, it's treatment that has been proven to help reduce symptomology of disorders like depression and anxiety. Like some people take medication, therapy can also assist in doing that. So we accept insurance for the not-for-profit. So we are helping clients develop resiliency and to cope, to live to establish a foundation, to live a healthier life, you know. So that's what we focus on here. We have a boutique style practice, meaning that we tailor our services to meet the specific needs of clients that contact us. We also offer play therapy services. I actually am a registered play therapist. That's a specialized treatment for children. Some children have a difficulty communicating their thoughts and experiences, and therefore play is a treatment method that is used to help guide them through that process with the use of toys, sand tray, art, all of those fun things that children enjoy. We also have a therapist here that specializes in working with the LGBTQ plus community, as well as a bilingual Spanish speaking therapist on site. So it's a total of 4 therapists here. We have an office manager that navigate the process of scheduling. So that's Strive Counseling. So I have a nonprofit, Nurture of Alabama, which I founded in 2021. And we provide mental health support groups as well as counseling services. We've had some amazing partners. We've provided groups to Jefferson County Family Court, juveniles that were court ordered for anger management. We have partnered with the Birmingham Housing Authority and working with their residents and providing mental health support groups as well. And again, we provide those counseling services. But one of our biggest, or I would say most, one of our programs is our Community Mental Health Awareness Initiative. If many of you are not aware of the City of Birmingham Mental Health Day, it is a partnership with Nurture of Alabama, the Mayor's Office of the City of Birmingham, and Birmingham Park and Rec Board. We organized a event where we engage community partners throughout the city of Birmingham, and usually it's about 50 to 70 local organizations, private practices that are collectively sharing information about their services. Our goal is to um, destigmatize mental health by raising awareness. We have expert panel speakers on that day that share resources during the event. We are also improving accessibility. That is so important, which is why I am in the field, and we'll get a chance to talk about my why.
Mhm.
It is very important that people understand where to go. They understand the face behind the businesses, and they understand that there are people that really care. And we're here to establish hope, build trust, and to make sure the community needs are met. So it's wonderful. And following that event, Nurture have monthly mental health events. We highlight pertinent topics. Dana Purdue will be presenting on trauma informed care in July, but those events can be found on our website. So we're doing impact work. That's what I believe in, impact work.
Mhm.
So
Yeah.
that's just, a overview of Nurture of Alabama. We are shifting the conversation about mental health so that all Alabamians, can have access to services and to destigmatize mental health. And with Strive Counseling Services, we're providing that holistic care to clients that are insured through evidence-based practices.
Yeah, I love that. And of course, as a pharmacist, hearing evidence-based practices kind of piques my ears because that's how we practice medicine, whether it's counseling on a prescription or making sure that the patient is on the most up-to-date, effective therapy. It's all evidence-based. So I can definitely appreciate that in mental health. So you kind of alluded to this, but let's talk about your why. Why mental health? Why, did you go into this field and why did you open your own practice?
Wow. Well, that's a great question. So there are three things that I want to touch on. Number one, which is the most important thing, my mother. Without my mother, I wouldn't be here. So give her all the glory in God. But my mother died when I was 14 years old. But just to kind of give you some context about my mom, she was a social worker by trade and she worked for the Department of Human Resources. So I was exposed to social work, the work that social workers do in, in child welfare, making sure children are placed in safe environments. And she was so compassionate and it just came easy to her. And I just love the fact that she was able to help people establish hope for children. I mean, that is magnificent. So I grew up exposed to her making such an impact. And I knew immediately, like, if this is called work, this will be easy. This is something I want to do because I love people. I am compassionate and I like to see change. And I know that change is within us and we have the potential to do so. So that's the first reason why I chose to become a social worker. The second reason is, as I mentioned, my mother died when I was 14 years old. That's a critical stage of development.
Mhm.
My mother and I was so close. I loved her so very much. And having said that, post my mother's death, no one in my community reached out to me to encourage me to receive mental health services or support. I'm from Demopolis, Alabama, a small town, then a population of about 7,500 people. And I was really connected in my spiritual community. I was an avid church attender. Also, I was very engaged in sports. I was surrounded with good friends. I come from a pretty good family,
Mhm.
educated family. But again, I guess people thought I was okay. I thought I was okay because I was just going along by my daily routine of life, dancing, running track, spending time with friends. And it didn't hit me until I decided to, venture off to college. I knew I was going to Alabama A&M. I'm a third generation grad. My mother attended A&M, her sister and my great aunt. So I knew that I was going there, and I knew that I wanted to become a social worker. But what I did not know is that I needed grief counseling
Mhm.
until I got there to arrive. And I, of course, pursued my healing journey then. And then I reflected back and I said, oh my God, third point, there is a need. And
Mhm.
there's a need in that community specifically, but not just the need in that community. I realized that not to anyone's fault, my family, friends, mentor, school
Mhm.
counselor, I mean, it was just a stigma, right?
Mhm.
Stigma attached to mental health. There wasn't any resources available. You're talking about a private practitioner. No, they didn't have those resources.
Mhm.
So I knew there was a critical need, and I knew that I had to bridge the gap. It's a social responsibility.
Yeah.
I'm just so happy to, have lived through that experience. Resilient people understand like things gonna happen, and I
Mhm.
but what do we do with those experiences?
Mhm.
So what I'm
Mhm.
doing with that experience is giving back, providing education, providing services, and establishing hope for others that have struggled along the way.
Yeah, and I love how you mentioned the fact that, you didn't realize you needed grief therapy or a healing journey. It was what, 4 years later, you were in college and
Yeah.
like, so was it the realization that something isn't right or what, like what inside did you feel that was like, I really need to,
Yeah, thank you for asking. No one has ever asked me this question.
I'm just
I
curious.
love it. I love it. So really what happened was I was removed from all of those things. That the
Mhm.
environment
Right.
where I was busy, right? So life has settled down, and I actually lived off campus with my god sister during that time, my freshman year. And I remember being in the apartment. I was looking in the mirror, and I'm like, I'm empty. Something's wrong. I didn't
Mhm.
feel like myself. I recognized that I was experiencing symptoms of depression.
Mhm.
So that's when it occurred to me. When I was going through the social work program, of course, we were having conversations surrounding mental health. And I'm like, wait, something's not right.
Mhm.
And in that moment, I knew I needed to begin my healing journey. But my spiritual mentors were really impactful and significant during my healing journey as well. As I was going through that therapeutic mental experience, trying to, deal with my grief and communicate it effectively, I also connected to what I knew, and that was the church. I taught collegiate Bible study, and I love being in church.
Mhm.
Those two things coupled really helped me overcome my
Yeah.
mental health challenge of grieving post the death of my mother, Elaine Mullen. I'm sorry.
Yeah, yeah. No, and I think you made a couple of great points that I want to highlight. The first is you can have your faith, your belief in God, and realizing that He's the ultimate healer, but you can also couple that with mental therapy and doing things to help increase your resilience. So I love that you mentioned that. And then I also love that you mentioned the fact that you had to, once you got alone, once you removed all of those things that were keeping you busy and probably keeping your mind and your heart busy, you were able to realize something isn't right. So for those out there who are, maybe dealing with grief or maybe they're dealing with something else, the economy is crazy, people are losing jobs left and right, and they feel okay for the moment, but like we say in the church, late in the midnight hour,
Yeah,
when you're alone, what are some things that people can kind of look for to recognize, you know what, something's not right here. I don't feel like myself.
that's right. Well, you heard me touch on grief, and grief symptoms, and I'm just gonna speak about that from this
Yeah,
standpoint,
yeah,
okay, if that's okay. Um,
please.
but grief symptoms can mirror symptoms of depression, right? So you have the sadness, you have the changes in your sleep or your changes in your appetite. So that can be insomnia, hypersomnia. You can have you're overeating, gluttony, or you're, not eating enough.
Mhm.
You can have the tearfulness. But see, what's very different with those symptoms and the symptoms of depression, the symptoms of depression cause interferences in your daily functioning, right?
Mhm.
So, and they persist for 2 weeks or more. So my symptoms were persisting.
Mhm.
And matter of fact, it was no longer acute grief. I mean, this is like exceeding beyond a year. We're talking about complicated grief,
Mhm.
complicated. So I was very much so dealing with complicated grief. And I'm not one that tends to withdraw,
Mm.
but I was withdrawn.
Mhm.
Now I have to find friends. Now, I mean, and I'm realizing like I'm not myself. So just recognizing those symptoms, and we do so by educating ourselves. We have to be aware. That's another symptom of someone or sign of someone that's resilient. They're self-aware. You have
Mhm.
to be aware what these experiences are, and we have to be courageous in speaking out about them. Culturally, there's a messaging in the Black community, especially with women, that we are supposed to be strong,
Mhm.
and it's transmitted, through generations.
Mhm.
And we hear, we supposed to carry this strength, but that means I mean carry stress, right? But
Yeah.
that's not a strength, that's
Mhm.
a weakness.
Mhm.
And we supposed to sweep things under the rug and not talk about, why we feel the way we do. We will be judged for that reason. But we got to do better and understand strength is in communicating experiences. So
Mhm.
that's how I knew that I needed to receive support. And it's okay. Like your spirituality is good, but you can't rely on that alone.
Mhm.
You know, treatment like your therapist can include in your treatment plan, prayer, your daily devotions or journaling, all of those things are wonderful, but you got to have someone that is an expert that can guide you in developing healthy coping skills by improving your thought processes and developing healthier behaviors and healthy habits for living.
Yeah, and I think it's important to note that there are certain tools that you can use to improve your mental health, to increase resilience, so that when lifes,
Hmm.
you'll have the tools necessary to help kind of deal with that. So you talked about journaling, you talked about prayer, meditation. What are some other tools that y'all kind of talk to your clients about to increase their resilience?
Absolutely. So, number one, there are different approaches. You can use a client centered approach. And I said early on, like the client is the change agent, right?
Mhm.
So, one of the things that we do, we help clients identify, their strengths, because I think that is foundational. When you recognize those strengths, you realize, okay, I feel a little more hopeful. I have the potential to change the trajectory of the situation. So, that's one way. And one of the biggest things, the components of providing therapy too, is helping people recognize their support system.
Mhm.
Some believe I have no one. I have had so many clients say, there's no one that can support me. So I assist them. Let's create a list of those people in your life that support you, or that you may think would be there, or that you just believe will not be there. And then
Mhm.
we start to look at that list and they're like, wait a minute. And they realize, okay, they never asked.
Mhm. Mhm.
If you don't ask and you walk around like you're strong,
That
um,
part.
yeah, you got it all together. You're polished. You don't need no help. You don't need a man. You don't need none of those things, but you do need support.
Mhm.
Everybody needs a village.
That's right.
You are someone's villager, so someone can be that to you. So
Mhm.
looking at that, we also provide, cognitive behavioral therapy and
Mhm.
evidence-based treatment to help explore your cognitions. We have negative thoughts, right?
Mhm.
But helping you identify, those cognitive distortions and understanding how to dispute them. That is
Mhm.
critical, and helping you understand how significant your thoughts can have influence on your behavioral responses. That's major. Like
Mhm.
that empowers you to know, okay, now one thing for sure, I can't control people, but guess what? I can explore these situations in my life that are triggering me.
Yeah.
right, that are causing me to develop these negative thought processes and causing me to respond, like lash out with anger,
Mhm.
withdraw from others. Now I have the power to change that.
Yeah.
That's significant.
Yeah.
We provide that, and so many different other treatment approaches. And that's why it's great to have a licensed therapist to guide you in utilizing those treatment methods to monitor your symptoms to see
Mhm.
if there's a reduction, because if so, there's an improvement in your ability to function, right?
Mhm.
Also, we encourage people to indulge in like healthy self-care practices.
Mhm.
Or what do you like? What have you done before and you've lost yourself? Think about new moms, right? They go through this process of like they're having to go through this process of self-discovery because they
Mhm.
invest so much of their time into taking care and nurturing their child. And then, if married, to be a good wife, but you're not being good to yourself.
Mhm.
So, exploring things of that nature. So linking clients to resources. So it's so many different methods or coping strategies that we put into or help clients add to their toolbox to improve their life so they can have a healthy foundation to thrive. That's what we want to see our clients do, thrive and grow. And of course, refer clients out, whether it's to
Yeah.
you all, right?
Mhm.
In which we'll talk about that. And we also have a psychiatric nurse practitioner that
Mhm.
French that provides medication management here at Strive Counseling.
Yeah. So I think, we can go ahead and go into that because I love the fact that, a lot of people, I read a stat once that said something about before people actually seek therapy, like they've had symptoms for it could be 2 to 3 years before
Mhm.
they actually seek help. And a lot of times, because they don't necessarily want to go on prescription medications, they will see a therapist before they see a provider, whether it's a nurse practitioner or a physician.
That's
So
right.
the fact that you can see clients and you can help walk them through and add tools to their toolbox. And if you guys, the clinician and the client, get to the point where we think you may need additional help, you can refer them out to a clinician who can then proceed with the medication route if that's appropriate.
Right. Right. And
Mhm.
so that's what I love about what y'all are doing. Gosh, I mean, I've never seen anything like it. Seriously. I mean, you can sell your brand like pretty much.
Yeah.
Amazing. But I love what you're doing. I love like what Dr. Carter, Adrienne Carter is doing,
Mhm.
Fernando Carter, Dr. Cree. They're so amazing because they're engaging with their patients and then they're recognizing, they're ruling out physical and they're recognizing it's the mental, right?
Mhm.
And they are great at making those referrals to clinicians. Okay.
Mhm.
And not only making those referrals, they're following through, making sure the
Yep.
clients are on track. That
Yep.
is significant. Now, some clients may choose, Dr. Long, to, take medication during that
Mhm.
period of time, right? And some are reluctant because we know that there is a mistrust in medicine. I mean, we're not
Mhm.
surprised to hear that,
Mhm.
specifically in the Black community, right?
Mhm.
When that's the case, it lowers healthcare utilization,
Yes.
and it causes what poor health outcomes, like
Absolutely.
you are
Right.
treating the illness, and
Mhm.
of course the difficulty trusting. So that's when I knew, okay, I know that Meds Plus Consulting had the answer, and I knew you all had the answer to that, and that's why I reached out to you.
Mhm.
Because again, it goes back to the educating piece. Yes, some clients have been on multiple medications.
Mhm.
They aren't seeing any results. Maybe perhaps not any of the three I named, are seeing
Mhm.
doctors that aren't spending quality time with them, understanding what's going on, perhaps through the
Mhm.
book they share with me. So now it's like I don't want to take medication at all, but these are some clients that really need it.
Yep.
What's the answer? Now
Mhm.
we have the answer through your testing. And
Yeah.
I'll let you kind of segue us into that, and then we can kind of, bring that all together. But I just think the three married, I mean, you got the Trinity,
Yeah.
really. I
Yeah.
mean,
I agree. I agree. So yeah, we'll definitely talk about our partnerships. So Strive Counseling Services and Meds Plus Consulting, we have a partnership where Crystal and her team actually refer patients to us for genetic testing. So if you haven't heard about our genetic testing before, we actually do two types of genetic testing here at Meds Plus. One is called pharmacogenetic testing, and that is where we take a sample of your DNA and we look at the way your specific genetic makeup, the way you respond to certain medications. So typically medications are prescribed based on symptomatology, family history, and the prescriber makes a really good educated guess about which medication out of a specific class you may respond to. Well, with genetic testing or pharmacogenetic testing, we're able to kind of narrow that field down. So if there are 15 different antidepressant medications, we may be able to narrow that down 3 to 5, maybe 4 or so that you're more likely to respond to based on your DNA. The second type of genetic testing that we offer is nutrigenomic, and it's just like it sounds, it's regarding nutrition. So we know that when you're dealing with certain, especially psychological conditions, there are certain biochemical pathways that take place so that your body makes things like serotonin and dopamine. And there are some people that have genetic weaknesses in that pathway. So you got to figure if you're building a bridge and, for a mile of the bridge, there's a weakness there, it's going to be hard to get across that bridge. That's what we look for with nutrigenomic testing, is we look in those pathways. If there are any genetic weaknesses, we're able to provide supplementation. So that's vitamins, mineral supplements. And we're also to recommend lifestyle changes that may help support those weaknesses. So those are two of the processes or two of the services that Meds Plus offers. And we offer those to clients of Strive Counseling Services. And you've been a great referral source to us, just letting people know that these services are available and referring them to us for testing. So what have you thought about the response? What have you thought about the way your clients engage with genomic testing?
Well, they're shocked. They're like, what?
But it exists.
Mm-hmm. It's like right up the street, right? So yeah, so I educate them about it, and I mean, of course, the clients initially present with a complaint that they've been taking all these medications, and they don't want to continue their journey on meds, and they are responding really positively. I have to follow through. Hey, did you follow up? I mean, just at least do a consultation. We're talking about the education piece. I mean, we're not just testing you without understanding the purpose, the outcomes, like the potential outcomes, and how this can have a greater impact. And what I love the most and what they love the most about it, I mean, the three of us will be involved. And when I say the three of us, myself or whoever is treating them here at the practice, as well as their medical provider. So it provides everyone insight. So that's a win. It's definitely a win. So great response. And just to share a really quick story, I had a speaking engagement back in Selma, Alabama, which is in the Black Belt, not far from my private practice is in Demopolis. And a pharmacy actually spoke about medications because she was doing a mental health awareness piece as well and educating attendees. And so at the end, I asked her to have a conversation with the group about the testing. And so she was not aware of it. So I'm saying that to say, y'all are really doing some really progressive work in this community. She's a pretty young pharmacist, and she was like, tell me more. I even recommended her reach out to you guys. But yeah, I mean, it's important. And I guess the people in the audience too were like, what? I mean, they were kind of shocked. And so just to be able to raise awareness about that is significant as well. Because again, it's all about establishing trust, because we want people to know that there are options, viable options, and there are trustworthy people that are competent to deliver professional services, because we want to see them have some really positive health outcomes.
Absolutely. And that's the ultimate goal. When you think about it, the ultimate goal, whether it's from the mental health perspective, from the pharmacist, the physician, it's about improving outcomes. We all went to our respective schools and got our degrees to help people improve their lives. And so that's the whole point.
That's right.
So I would love for you to wrap us up today. For someone who's struggling or not sure where to start, what would you say to them? And then I definitely want you to talk more about the mental health day with the city of Birmingham as well.
Sure. Okay. Well, the first response, if you are struggling, number one, know that you're not alone.
Mhm.
Like you are not alone. And if you feel uncomfortable starting your healing journey, when I say healing journey, that's number one, acknowledging you have a problem. That's the beginning of the journey, right? And being self aware. Ask someone that you're close to kind of support you, and going through, to your first session. But reach out to someone. There are therapists throughout the city. You can look on what is it called? There's a director, it lost me as I'm talking, but you can research different therapists that are available to you. And if you go to your first therapy appointment and it's not a good fit, don't stop there.
Mhm.
Give it a chance and visit someone a second time
Mhm.
because you matter.
Mhm.
So I would say, don't quit, don't ever give up, nurture your growth and know
Mhm.
that there's potential for you to strive and be healthy.
Yeah,
So that's always
absolutely.
the goal. So I want to encourage that. You can reach us here at Strive Counseling. Like I said, you can visit our website, www.strivebhm.com. We have 4 therapists you can choose from. You have options,
Mhm.
as
Mhm.
well as a doctor that can treat you if you need medication
Yeah.
management. He takes Blue Cross Blue Shield and out of pocket payments as well.
Mhm.
So if you're interested in the nonprofit Nurture of Alabama providing you counseling services, give us a call. Visit the website www.nurturebham.com. Now, in reference to the City of Birmingham Mental Health Day, Nurture of Alabama is partnering with the mayor's office as well as Birmingham Park and Rec Board to provide you community resources. On that day, we will have at least 50 plus community partners sharing resources. We will have food trucks. We will have line dancing. We will have a DJ. We will have giveaways. We will have just all fun things to create a fun, exciting environment, yet an environment where you can learn from our speakers. We have speakers that day that will, share some pertinent topics surrounding mental health. And if you would like to be a part of this event, show up because guess what? It's free. There's no charge. All you got to do is just walk up to Lynn Park and be present to enjoy
Mhm.
all of these great resources that we are going to provide on that day. My keynote speaker is out of Atlanta, Georgia this year. He is phenomenal, Montalito Irby. So he will be speaking. And I have some other speakers that I'm not going to release their names just yet, but I'm telling you, my lineup is usually pretty good. I'm not going to say usually pretty good. So
Mhm.
we're going to have blood pressure checks on that day, glucose checks as well. We will be doing mental health consultations. We will have chair yoga. We will have all types of different activities in the park. I have somebody leading a low impact exercise for you all to learn. Um,
Mhm.
it's going to be great. It's going to be fun, but a wealth of information, a wealth of resources, and different professionals that you can engage with. And you'll walk away knowing I'm going to be okay. I am
Mhm.
full. I am loved. I am valued. So that's the goal to help
Yeah.
support you on that journey. And I did wanted to share my book.
Sure, absolutely.
Yes,
Let's know.
the 21
We
day
like to hear.
yes. So the
Uh-oh.
21-day journey to
Wow.
strive for a healthier you.
Okay. Let's say
Dr.
it again because I think I had you off.
I like to laugh. If y'all meet me, I love to laugh. But it's my therapeutic interactive journal, and this is for someone that has never been to therapy because it's an intro to therapy. It has evidence-based information in here, research, and it's really practical. I'm asking those that use it to spend at least 20 minutes a day um,
Okay.
and developing some introspection and journaling about it. Like the first chapter is about loneliness. We are seeing many
Mhm.
people battle with loneliness. We
Mhm.
have a chapter about self reflection, approval addiction, I'm telling you,
Mm.
this is a must buy. And if you have been to therapy before, this is a great tool my clients use, outside of treatment. They work through it and it
Mhm.
adds value to their treatment process. So there's a pre-assessment in the initial in the beginning of the book and a post assessment. So we got to understand where we are when we start,
Mhm.
understand how this book has contributed to your growth at the end. And then there are breathing exercises in the at the end in the reference page. So, I ask, after you finish journaling, that you practice the breathing exercise, and then there's a quote. So you have all that you need
Yeah.
to be mindful and to practice healthy self-care.
And I love it. It sounds like it's good for those who are contemplating therapy, those who are in therapy, those who have just come out of therapy, because it just makes you aware of yourself, things that's going on that you may not recognize if you don't take the time to sit down and actually be guided through those questions.
Right, absolutely. It's great. I've worked it. My book club has worked it. I
Mhm.
mean, it's great, so it could be purchased on Amazon,
Okay.
and you can get it the next day. You
Okay.
can purchase it from my website, and if you purchase it from me, I'll sign it. You'll get it within 3 business days.
Okay.
So please, just know that there is help available to you, and
Mhm.
Strive is a resource to you. I love mental health. I love people. And
Mhm.
if there's something that you need from me, even if I can't, support you on your healing journey or provide therapy to you, just contact the business. We're gonna
Mhm.
guide you. We're gonna make sure that you at least have some options. And that site I wanted to mention earlier was Psychology Today.
Okay.
The Psychology Today, and you can include your zip code, and they will. There's a list of therapists that will populate, and you can identify the insurances they take, how much they cost if you pay out of pocket. I mean, you can read their profile. So select. You can choose. If it doesn't work, find you someone else. So thank you so much.
Yeah, thank you, Crystal. And we definitely want to thank Crystal Mullen-Johnson, CEO and founder of Strive Counseling Services, for joining us today. I didn't realize that link was going to split like that. Want to also remind you guys real quick about our Pharmacy Pathways program. We are still enrolling for the program. We will be starting a new cohort in the next couple of weeks. So if you or someone you know is 17 or older, and you're considering a career in healthcare, and you may want to consider pharmacy technician or maybe pharmacist as a healthcare option, healthcare career for you, definitely enroll in our free training program. This is powered by the Good Jobs Initiative as well as Prosper Birmingham. So definitely want to remind you of that. You can go to our website to learn more. And then we also want to remind you that we are enrolling for our second cohort of our free community diabetes education program. So we are finishing up the first cohort now in North Birmingham. Starting around the second week of June, we'll be at Renew Birmingham in Ensley. So if any of you are in Ensley and surrounding areas, Fairfield, Brighton, Birmingham, contact us. And if you have type 2 diabetes, or you know someone that has type 2 diabetes, you need to be in this class. There are too many of us who have diabetes. We go to our doctor, we don't really take the medicine correctly, and we're suffering complications as a result. So our A1C is elevated. We're having things like neuropathy. Our kidneys are being damaged. Our eyesight is declining. All of these things are due to elevated blood sugars. And through this course, we teach you how to self-manage diabetes. So if you or someone you know has diabetes, definitely give us a call at Meds Plus to get enrolled in the next cohort. Our number is 205-650-4636. So, Crystal, thank you so much for joining us today. I know you are a busy woman, and I just appreciate the insight that you gave us into mental health. We're on the kind of last couple of weeks of Mental Health Awareness Month. So, definitely want to bring y'all quality content regarding mental health so that you'll feel empowered to go out and find someone that can help you live well holistically, not just in one area of your life. Do you have any final thoughts or parting words?
I don't. I appreciate the opportunity. Please join us for that mental health day just to gauge different providers. And I just look forward to you being healthy and well.
Absolutely. And we'll continue to share that flyer on our page. We've been there the last 2 years, I think, I know specifically. And it's always a great turnout. There are dozens upon dozens of vendors that are spaced out, is well organized. Y'all are going to love it. So we'll share that flyer on our page as well. Thank you, Crystal. I hope you have an amazing week.
Bye. Thank you.
Bye, everybody.
At Meds Plus Consulting Pharmacy and Wellness Center, results matter. Don't settle for less when it comes to your health. Empower your health journey with a pharmacy that puts you first. Transferring your pharmacy is easy with our guidance. Plus, we offer prescription delivery and medication management.
Bringing the pharmacist back to the community. Meds Plus Consulting Pharmacy and Wellness Center.
Visit Meds Plus Consulting Pharmacy and Wellness Center in downtown Birmingham at the new South Federal Building.